Hello, I'm Dr. Lama from Dr. Lama Medical Center. Let's talk about urinary tract infection. And what are urinary tract infections? Well, the urinary tract itself is divided in lower urinary tract and the upper urinary tract. So the urinary tract, lower urinary tract begins from the urethra. It's an opening that's outside of the body where the urine comes out of, and it goes up to the bladder. And any infection in that area is called cystitis. And that's more common. And then we have upper urinary tract. The upper urinary tract goes from the urethra, that's a tube that's approximately 10 centimeters, and it connects the bladder to or the kidneys to the bladder. And any infection above the ureter to the kidneys is called upper urinary tract infection or pyelonephritis. Okay, so urinary tract infections are very common, and up to 50% of the women will have an infection at some point in their life. So the urine and the urinary tract are usually sterile. And then bacteria can get in the tract is usually through the urethra, through an opening in the body where the urine comes out of. And from there, the bacteria go up and cause the infection. There could, on some occasions, it could spread from the blood, but that's less common. The 90% of the time, it's caused by bacteria that most people have heard of. It's called E. coli or Escherichia coli, and that's up to 90% of the times. 5 to 10% is caused by a bacteria called Staphylococcus saprophyticus, and also uncommonly we could get fungus or viruses causing a urinary tract infection. There is other infections caused by the bacteria when the patients are in the hospital or patient uses a catheter to help drain their urine from their bladder, that they have to do it at home. And these bacteria, you might hear Klebsiella, Pseudomonas, Candida, Enterococcus. And infections are more common in women, and the children and elderly adults can get infections too, but their symptoms may be different or negligible, and they might present with more advanced infections. And in these cases, sometimes we could have kids or adults show up with fever or confusion even. So these need to be suspected earlier. What are the symptoms of urinary tract infection? Okay, so burning with the urination is very common. Frequency of urination, going often. Urgency of urination, the sensation that you have to go quickly or go often, even after you've already been, is another common symptoms. There could be pain in the low abdomen or low back. Also, symptoms of the urinary tract, upper urinary tract infections include more severe symptoms, like we mentioned, including fever, chills, nausea, and vomiting. Okay, so what are the differential diagnosis of these conditions, of similar things that could cause similar symptoms as urinary tract infections? And these include sexually transmitted diseases, STDs. And STDs usually affect the urethra, so they're called usually urethritis in men. And they're different bacteria, and gonorrhea, chlamydia are common. But in women, it's usually cervicitis, affects more the cervix of the uterus. Another condition is prostatitis in men. The prostate gets inflamed or infected, and the symptoms are very similar. But the treatment's a little bit different. Another condition called interstitial cystitis can be confused with a urinary tract infection, but these conditions are usually chronic. Symptoms are similar, but usually do not respond to antibiotics, and usually the cultures are negative. Talking about cultures, what tests do we do for urinary tract infection? The common test is a urinalysis, a UA. These are done in the lab or could be done right in the office. They just take a few minutes to perform. Urine cultures, on the other hand, are sent to the lab, and it's a culture needs to be put in a special medium in an incubator. It takes usually 2 to 3 days, but the advantage is that we get a specific pathogen that's causing the infection, and the response to the antibiotic. So that's very, very helpful. What antibiotic works is what we're going to get from the urine culture. So if you have any comments or questions, please place them down below, and we'll try to get to your questions as soon as possible. Okay, continue with the talk. the risk factors. So what things can worsen or cause ear infections or cause them more commonly? Sexual activity is known to increase the infection rate, and there's things we can do about that. So we'll go get that in a few minutes. But anything that causes an obstruction in the urinary tract, and it could be anatomical anomalies or it could be a renal stone. There's also medical complications that affect the emptying of the bladder, usually a paralysis or a neurogenic bladder where the bladder doesn't contract correctly to empty fully. With the urine sitting in the bladder, it is more likely to get infected. Women that are past their menopause, postmenopausal women, because of lack of hormones or decrease in hormones, sometimes they're more exposed to infections. Anything that lowers your immune system, diabetes, HIV, chemotherapy is more susceptible, makes you more susceptible to infections. Men with enlarged prostate also have more trouble emptying the bladder, and with the bladder, the urine sitting in the bladder more, they get more infections. Uncircumcised men can have more urinary infections. Certain birth control, like diaphragms and spermicides, increase the risk of urinary tract infection. And there's people also have a genetic predispositions, and they're just going to have more urinary tract infections. So this is something that can't be avoided, but some people already know it, so they need special considerations for treatments, and they need to be treated probably more often. So what can we do to reduce infections, to prevent them? One of the things is, we mentioned sexual activity, it can increase the rate. So urinating after sexual intercourse, just having urine flow through the urethra washes out bacteria and reduces the rate of infection, because the bacteria get up through the urethra into the bladder. So just urinating will do that. Also, washing after intercourse can help. Drinking more water for the same reason. Drink more water, you're going to urinate more, the bacteria flush out, and the tracts stay cleaner. Cranberry juice is some studies have shown that could help and reduce urinary infection. The other thing we try to avoid are baths. It's better to take a shower versus a bath because of the risk of infections too. Also, women should avoid vaginal douches or vaginal sprays and powders that could irritate or cause infections. Also very important is teaching children, small girls, to wipe properly, usually from the front to the back, and drop the paper so they don't bring bacteria from the posterior part forward that will cause infections and colonize the urethra. So this is a short talk, but if you have questions, please put them down below, and let us know, and we're happy to do these talks for you. So thank you for participating, and you have a good day.